It's more about validating the work that so many people in our organization have been invested in over the last 4 or 5 years. So this is something where you hope you're doing the right thing, you feel you're doing the right thing, and then when others can acknowledge that what you're doing actually has an impact and potentially could be used and shared with others to have the same impact, it just feels really good. And mostly for the people that are really interfacing with the skilled facilities every day, excited to go back home and have individual Doyle awards in each one of our regions to share this as well. I think that all our regions are very passionate about the work they're doing, and this will just be one way of celebrating that work. So being able to have this evidence-based criteria available as a standard approach in all of our regions, it gave confidence to our staff, and it really was not based on subjectivity, but really on this is evidence-based information. So let's really now sit down with the patient at the focus of all this. How do we really work on transitioning this patient home in the best possible manner while also being focused on the fiscal responsibility of managing healthcare. Our organization owns 5 skilled nursing facilities. The other 90 in our network are independents. And so there was internal knowledge about how to manage this. There just wasn't a lot of consistency from region to region where we could globally impact on the results. And when we became Next Gen ACO a few years ago, one of our largest opportunities was changing our length of stay in skilled nursing facility space. And being at risk for about 90,000 individuals with millions of dollars on the table, we had to do something where we could have a global impact on our work with SNFs. What we've been able to show is that nursing homes will actually come to the table and say, we have not only improved in avoiding penalties for ourselves, we also probably have moved faster towards quality initiatives that we wanted to get to, but because of this engagement and relationship have gotten there much faster. It has to be about the patient, and one of the things I think we were pressured with at first was, okay, you're going to drive patients out of here, they're all going to end up back in the hospital, and how is that good for anybody? But what we were able to show is that we decreased length of stay significantly with and you will see that the same change came in rehospitalizations. So we not only dropped length of stay, we also dropped rehospitalizations, and we also saw the patient satisfaction also follow that in a very positive manner. And I think really the key to this is that people were probably staying in the nursing homes way too long already. For some cases, they're necessary components of healthcare, but we did see this spend that we thought we could control better. But I think that the way we did it, without just saying, sending a pink note to the nursing home along with the patient's chart saying they can only stay 10 days, this was a very collaborative engagement saying, our evidence-based information from MCG says they should be here 18 days. We just heard in your care management that we're sitting around the table with 35 days. We need to understand that. And we understand why 35, why 18, maybe it's 22. But we need to have that conversation, understand what's the best for the patient, for them to return home or to their place where they live. It may be assisted living or independent living or maybe another environment. But we have to figure out what that goal is and what's the best way to do that, avoiding all of these other crises that may occur.